Welcome to an advanced training on the GSI Audera Pro ASSR module. ASSR is an evoked potential test that uses frequency-specific test stimuli. Each stimulus is modulated at a unique or different rate. The cochlea is stimulated by the frequency, or hears the frequency. The brain perceives the modulation. The brain, or the EEG, is analyzed around the modulation rates, and the analysis is statistical. So the software has a built-in algorithm that determines the probability that a response is present. We perform ASSR to obtain frequency-specific thresholds in infants and difficult-to-test patients. We determine the type, degree, and configuration of hearing loss and can often determine the severity of the hearing loss by testing at higher intensity levels than we can with traditional ABR test stimuli. First thing we do with Audera Pro is prepare the software. When you open up the software, you'll see the opening window. In the lower right corner, you should see a check mark there, which indicates the Audera Pro software is communicating with the hardware. If you see an X there, you want to make sure your Audera Pro is on and that the USB cable is connected. You will also enter the patient information from this screen. The identifier is automatically assigned by the software, and then you would only have to enter a first name and a last name to create a new patient. Once you're done, you can select the ASSR module and you're ready to test. When you launch the ASSR module, you'll enter the acquisition screen. This is a screen that's very similar among all the modules within the Audera Pro. The large white area in the middle of the screen is where the ASSR waveforms are going to appear. At the bottom is the collection toolbar. So this is where you will select the intensity level of the stimuli and the ears that are going to be tested. The side toolbar has some key icons that you will be using throughout the test. The upper right corner is a live EEG. So as soon as you open the software, you'll see movement within the EEG window. So you'll get some idea of how relaxed your patient is before you even start the test. And right below that is where your impedances will appear. And then finally is the stimulus information section. And this is where you're going to pick and choose your tonal stimuli, but it's also an area that you will be monitoring throughout the test. So the Audera Pro includes tonal stimuli, those traditional ASSR test stimuli. By default, 5, 1, 2, and 4,000 hertz are selected. You can also access 250 hertz or 8,000 hertz. Last year, we added the CE Chirp octave band stimuli at 5,000, 1,000, 2,000, and 4,000 hertz. So you have a choice between using traditional tones, modulated tones, or modulated CE Chirp stimuli. The minimum number of frequencies that have to be selected is 1 per ear, or a total of 2. The maximum number is 4 frequencies per ear for a total of 8. So when you want to use tonal stimuli, you're going to select them from this stimulus panel. So you'll see the black boxes with check marks there. Those are indicate that that is the test stimuli to be tested. When you select the stimuli, you also have to select Activate Stimulus Selection. And when you do that, the frequencies that will be tested will appear above that area. So let me show you how that works. So in this case, I'm going to deselect 5, 1, and 4,000 hertz in both ears. I'm going to select Activate Stimulus Selection, and I'm going to wait a few seconds until I only see 2,000 hertz, which is the frequency that I want to test. So if you want to use CE Chirp octave band stimuli, you're going to select those in a different way. You're going to go to the Protocol drop-down menu and select Load Settings, and you're going to select from the list of the CE Chirp protocols. Each protocol below contains different frequencies. So in the case of these protocols, they're all binaural, meaning the same stimuli will be presented to both ears. The number that you see in the protocol name corresponds to the octave band frequency. So the number 5 corresponds to 500 hertz, 1, 1000 hertz, etc. So if you see numbers in combination, GSI Chirp 512, that indicates that the test stimuli that will be presented to the patient are 500, 1000, and 2000 hertz CE Chirp octave bands. So let me show you how that works. So similar case, we want to select an octave band instead of a tone. So we're going to go to the Protocol drop-down menu, Load Settings, and I'm going to select the GSI Chirp 2K protocol. I'm going to open it up, wait 1-2 seconds, and then I'll see 2000 hertz appear there under the stimulus information. I can verify that I'm using the chirp by going to the stimulus drop-down menu. Let's look at another example. In this case, I want to test 1, 2, and 4,000 hertz CE Chirp octave bands. So I'm selecting GSI Chirp 124 protocol, waiting a few seconds, and then I see that 500 hertz is no longer there in the left and right ear columns. And I can see that I have selected the GSI Chirp test stimuli. So to review, if you want to use tonal stimuli, you're going to use those check boxes and select Activate Stimuli. If you want to use CE Chirp stimuli, you're going to load a test protocol from the Protocol Load Settings menu. Moving on to patient setup. So in general, because this is an evoked potential, we're going to use all those good practices that we already know for ABR. If we're testing an adult, we want to make sure the adult is comfortable, has maybe pillows and blankets to assist with comfort. We don't want to be using any metal beds or electronic beds or cots. We should unplug those from the wall. We want to make sure that our electrode leads and insert earphone cables don't crisscross over each other. We want to keep them completely separate. And you want the patient's head to be positioned about at least a meter away from the evoked potential equipment. We're going to plug the Audera Pro directly into the wall using a grounded outlet. We don't want to use any power strips because they can introduce noise into the system. And then, of course, in the case of an adult, you want to give test instructions so they know how long the test will last, or give the instructions to the parent. So to perform an ASSR, it's easiest to use the snap lead cable, and you're going to place the electrodes as shown on the image here. The white electrode, or the positive, is going to be on the high forehead, low forehead is ground, and right and left earlobes are mastoids for the other two electrodes. Before we get started, after we've scrubbed the skin, we're going to check impedance by clicking on the impedance icon and waiting for the impedance results to appear right under the EEG. And remember, just like ABR, we want under 5 kiloohms and within 2 kiloohms of each other, or low impedance and equal. So There are two options to performing the ASSR. You can select an intensity sweep auto sequence or perform the test manually. And today I'm only going to cover manual testing. I think that might be easier and allows you to be in complete control of the test situation. So you'll understand what I mean when we move forward through the testing. So for manual testing, you're simply going to select your frequencies and test stimuli, decide on a starting intensity, and then select the test ears in the collection toolbar to begin the test. When you begin the testing, you can see the live EEG here, which is a little bit noisy. You can check the amplifier settings if you want, but the gain and high and low pass filters are locked by the software. You're going to check impedance, so here you can see please wait. It will check impedance on all the locations, and if impedance is good, you can select the ear or both ears to test. As soon as you start the test, you'll see the SNR window appear, and in the upper left corner, you will see the number of sweeps ticking off. You won't see any waveforms until 20 sweeps are reached, and that's because we use block averaging. So the test results are updated every 20 sweeps. So as soon as we hit 20 sweeps, you'll see the waveforms appear at the bottom of the page, and the results will update. So the noise graph, you can close it, but it will pop up again. Is kind of a nice graph to see because it basically shows us that the longer we average, the amount of noise in the recording is going to drop. So this is something that you can kind of keep an eye on, and you would expect to see something like this, where the noise starting out really high and then lowering and lowering and lowering as we add the number of sweeps to our recording. So you've started the test, you've got your 20 sweeps, 40 sweeps, 60 sweeps. What you want to do is keep an eye on the stimulus information section. This is what you're going to monitor. As soon as those frequencies turn bright green, that indicates that a response has been detected. So what is a response? Well, the criteria for a response is signal to noise ratio. So the analysis, when we're looking at the test data, we're analyzing around each frequency of modulation as well as some of the neighboring frequencies to determine the signal, which is the ASSR response, and the noise, or the SNR. Noise is anything except the response at that modulation range. An SNR of 6.13 equals a 95% certainty that there's a response. So when the frequency turns green, the SNR is at least 6.13 or greater. There are a couple other criteria, such as a minimum response amplitude. So we want to make sure the response is large enough and not just some background noise. And we also want to make sure that the noise level is below a certain level, in this case 0.05. You can see that by visualizing the results when you select the ASSR analysis icon. And this is something that I think takes a little while to get used to because there's a lot of information on the screen. So when you launch this window, you will see a polar plot on the left and an FFT on the right. Exact same information, just displayed in a different way. I think it's easiest to kind of concentrate on the FFT. That's because you'll be able to see the responses, which are the red and blue bars, and those will appear at the modulation frequency. Noise is in gray, and yellow is repeatable energy. So on this FFT, you can also see that noise level of 0.05 microvolts. So you can see in this case that the noise is well below that. And then the minimum amplitude for a response which is 0.0125. So while you can see and monitor the EEG, here you can actually see the noise that's being picked up within the around the modulation frequencies. If you want to visualize the SNR, you're going to select the Show Table checkbox. And then I have highlighted, there's a lot of numbers there, it can be confusing, but what I've highlighted are the SNR columns. So the SNR at the modulation frequency is on the left, the SNR at the side bins is on the right. Those have to reach the 6.13 in order to be detected as a response. The other nice thing about looking at this data is at a glance, you can get some idea of how noisy the patient is. In this case, obviously, almost the entire FFT is gray, so this is way too noisy to get any usable data. Maybe the patient's moving around a little bit, maybe an electrode came off, so you can get a really at a glance idea of the noise. Here's another example where the noise is extremely low and there's actually no response there coming from the patient. And that you can see, you can barely see the red and blue, a little bit of gray or noise. So this is a really nice indication of there's no response there and it's low noise. The other thing you're going to do during the exam is load the audiogram. And the reason is the test stimuli are delivered in SPL, not HL. SPL, as audiologists, we're not really used to looking at audiograms in SPL. We're used to HL. So it's important to take a look at the audiogram in HL so you can determine how low in intensity or how close to a threshold you might be. For air conduction, red and blue circles are responses for the right and left ears. Open circles are levels that were tested but no response was detected. For bone conduction, red and blue triangles are used to indicate a response, and an open black triangle is a no response. So here's the ASSR audiogram in SPL. To change to HL, you want to go to the lower left corner of the audiogram screen. You can see HL correction there, and you want to select General Table. When you do that, it will convert the SPL results to HL. This is actually the same audiogram, so you can see how much of a difference the corrections add, or how much lower the thresholds go when you add the corrections. So the SPL to HL corrections can be viewed directly in the software by going to the audiogram screen and selecting Edit Values. You have to enter a password in there if you want to see. The password is GSI. But the correction is essentially the RET spell for that particular frequency plus the threshold estimate. So with the corrections that you see here, these are for insert earphones, you're going to take the SPL presentation level and subtract the correction. So if you're testing at 80 dB 500 hertz, the HL correction would be 80 dB minus 26 dB for 54 dB HL. The other thing is we recommend that you add harmonic components to the analysis. So you're going to make sure that that checkbox there below the FFT is selected. And when you do that, it will extend out the FFT graph. By enabling this and including the harmonic components, you are increasing the chances of passing because you're adding the energy at the next 3 harmonic components. So you want to make sure that that is set to on. Okay, so let's review. First, you select the test stimuli and the frequencies. You're going to start the test. You're going to wait about 20 sweeps for the waveforms to appear. That's when you first start getting test data. You're going to observe the stimulus information panel during the collection because that's where you're going to see the frequencies turn green, which indicate a response is present. You're going to open up the ASSR analysis window to view the FFT and the signal to noise ratio. And then you're going to also load the audiogram so you can view the results in HL. So this is all things that you're going to do while the test is going. Okay, so analyzing the results. So these are kind of tips and tricks as you're collecting. First, you want to make sure you have a minimum of 80 sweeps at each level. So just like ABR, we're not going to identify a wave 5 if we only have 50 sweeps at threshold. We want to have enough data there that's consistent so we know we've averaged out the noise and we're looking at a true response. So with ASSR, it's the same thing. So you want at least 80 sweeps at each level. The other thing is, while you can present 4 frequencies and test them at the same time, in a typical situation, you may not get responses for all 4 frequencies at the same time. So it might be best if frequencies are detected or responses are detected at some frequencies fairly quickly, it might be best to stop the test and remove those frequencies where you're not getting a response and then go back later and test them to fill in the audiogram. Want to make sure you've got those harmonic components enabled. And just general rule of thumb, when you get close to threshold, you might want to drop to 1 frequency per ear. And in the reverse, at high intensities, you should reduce to 1 frequency per ear for patient safety because a multi-frequency stimulus can be quite loud for the patient. And then finally, if you are getting a response, let's say you get a response at 80 sweeps for 1,000 hertz, you want to wait another 20 sweeps to ensure that the response remains. So you want at least 40 consecutive sweeps. And you want to make sure that if you're getting a response, you should also have a response at levels above threshold, just like an audiogram. So in other words, if a patient hears 25 dB during an audiometric test, they're going to also hear 30, 35, 40. The same idea for ASSR. If a response was detected at 30 dB, there should also be one there at 40 and 50, etc. So let's show you a few examples. So in this example, if you look in the upper left corner, you can see the number of sweeps is 141. And the responses were detected at 1, 2, and 4,000 hertz in both ears. In this case, it might be best to stop the collection, remove 500 hertz from the stimuli, and only pursue thresholds at 1, 2, and 4,000 hertz. Here's an example where we're looking at the SPL versus the HL audiogram. So remember I said during the test, you always want to take a look at your audiogram so you can kind of keep an eye on the levels that you're testing. In this example, responses, this is actually a great patient. In this case, the responses were detected at 80, 70, 60, and 50 dB, even down to 40 dB for almost all the frequencies in both ears. But this is in SPL. So if we convert that to HL, you can see that HL-wise, responses were detected below 30 dB HL for all frequencies. So most likely you're not going to test below 40 dB SPL in this case. You can, but it might be best to move on and maybe do other tests like OAE or tympanometry. So responses, true responses, should be present at levels above threshold. So if you look at this example, responses were present for all frequencies down to 60 dB, and then some frequencies at 50 and even 40. So if you look, let's start with 500 hertz. You can see that a response was detected at 80, 70, and 60, but not at 50, 40, or 30. This is exactly what you should expect. Same with 1000 hertz. Responses were detected at every level down to 40. 2000 hertz, every level down to 50. So this is a great example of a good ASSR audiogram where the lowest level was detected for each frequency, might not have been at the same level, but for each frequency, responses were also detected at levels, all the levels tested above threshold. In this example, it might have been best to stop testing when no responses are obtained at 10 or 20 dB below the last response. So if you take a look here in the left ear, the lowest response was detected at 50 dB for a couple of frequencies, but 40 and 30 dB were also tested. You could have saved time by maybe not testing at 30 dB. Because we've already established that at 40 dB there was no response for any of the frequencies, so you wouldn't expect a response at 30 dB. And then in this example, it's not a good idea or good practice to continue testing frequencies when no responses are obtained at consecutive levels above or below the last response. And what happens is there's a couple of things. One, you're testing too long. You're testing when you could have easily stopped and moved on to other tests. And number two, because this is a statistical analysis, the longer you average, the greater the chance of obtaining false positives. Now, it's kind of hard to decide what happened during this test situation. So seeing all the other test results like the FFT and the actual SNRs. But if we look just at the audiogram, let's start at 500 hertz. You can see a response was detected at 70 dB, but not at 60, 50, or 40. Testing that frequency should have terminated should have been stopped, because if you're not getting a response at 10 or 20 dB below the lowest threshold, there's no response there. The same thing for 1000 hertz. Response was at 70, but not 60, 50, or 40. So it would have been best to stop testing at that level. Just like in audiometry, if you get a threshold at 50 dB, are you going to test at 40 and 30 and 20? Of course not, because you know your patient isn't going to hear it. So it's the same thing here with ASSR. So you don't want to waste time by testing at levels well below the lowest detected threshold. And then when you do that, you increase the chance of a false positive. So you can see here that a response at 0 dB SPL, which is well below the typical normal hearing patient could even hear, is most likely false positives. Okay, let's move on to some of the common questions that we get. Question number 1, the ASSR analysis and audiogram icons are not visible in the side toolbars. So this is something that happens a lot. The reason is the computer display resolution is not set to the correct level. So what you want to do is right-click on the desktop of the computer and select Display Settings. And then you can change the display setting to 1920 by 1080. That's the minimum recommended. And then go back and view the software to make sure you're able to see those icons. Question number 2. The ASSR software is not working. It always tests all 4 frequencies, even when I only select one frequency, like 1000 hertz. The solution is you want to select the frequencies, then press Activate Stimuli Selection, and then wait a few seconds until you see only the test frequencies that you want to test under the left and right ear columns. Now in this example, this is specific to tones. Question 3. ASSR test is taking too long. What can I do? In this example, in this case, we recommend you make sure that harmonic components are selected in the ASSR analysis window. So you'll know it's selected when you see that extended FFT. Remember, this increases your chance of obtaining a pass. If you can, it would be a good idea to save this as a default setting. That way it's always selected and you don't have to remember to turn that on. Here you can see the difference in an HL Audiogram with harmonics off on the left and on the right. So you can see more frequencies were, or more results were detected, responses were detected when harmonics were included in the analysis. And we got closer to threshold or lower thresholds, particularly in the left ear. Question 4. I can't remember. How can I view the HL Audiogram? The solution is in the audiogram window in the lower left corner, you want to select General Table, and that will take your SPL audiogram and convert it using the corrections to the HL Audiogram. Question 5. How can I test bone conduction ASSR? Well, by default, the insert earphones are selected as the test stimuli, but you can change that. You can go to the stimulus dropdown, select device, and over to the right you can see the other transducers that can be selected. In addition, this is where you can actually turn on masking. So if you are doing bone conduction testing and you want to add masking, you would turn it on in this menu as well. Question 6. Do I always have to test 8 frequencies at the same time? The answer, of course, is no. So, couple suggestions. It can be a good starting point if you don't have any other audiometry or ABR results. So if you have no idea what the hearing level is, it might be a good way to start. However, if you have other test results available, such as ABR thresholds, then you can pick and choose the frequencies and the starting levels based on that test data that you already have. You can test any frequencies in any combination. So you can test 500 hertz in the left ear and 4 frequencies in the right ear. So it can be any combination, but you have to have at least one frequency in each ear. We do have additional resources on the GSI Audera Pro as well as our other products on our website. Thank you so much for tuning in and have a great day.